Thank you for joining us for the fourth annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the key to accelerating innovation, a collaborative partnership event presented by the American Association of Kidney Patients and the George Washington University School of Medicine and Health Sciences. My name is Dr. Janice Lee. As a nephrologist, I am honored to serve on AAKP's Board of Directors and Executive Committee, alongside many kidney patients and care partners. I am currently a professor of medicine at Emory University in Atlanta, Georgia. I'm board certified in nephrology and hypertension. I also have the pleasure of serving as the clinical director of nephrology and of telenephrology and the chief medical director of Emory Dialysis, which serves over 750 patients. I'm proud to have been designated as a master clinician at Emory Healthcare and serve as the chief of staff at Emory University Midtown Hospital. More recently, it was an honor for me to be appointed to the Nephrology Board of the American Board of Internal Medicine. As a nephrologist, my research has focused in hypertension, chronic kidney disease, dialysis, and health disparities. It's been very exciting and rewarding for me to be a part of AAKP. It's actually been the most rewarding experience I've had throughout my medical career. I enjoy the patient advocacy, being involved in several initiatives to improve outcomes in kidney disease patients. AAKP is truly a patient centered organization. I've had the pleasure and opportunity to participate in several activities, such as being a senior advisor to policy, research, and clinical trial activities in conjunction with several federal agencies. I've been very involved in giving webinars and speaking on different issues that are relevant to kidney patients, um, mostly around home dialysis and increasing utilization, talking about the healthcare disparities that exist around home dialysis and transplant. Also focused on the COVID pandemic and very timely information for patients to help navigate during that very difficult time. I also spoke regarding how to use telemedicine so that patients could continue to be connected to their healthcare providers throughout the pandemic. And whether you are a healthcare professional or patient as an AAKP member, you can do the same. It is critical now that we as patient consumers raise our voices and create the demand for new diagnostics, devices, and biologics in our independent countries. Through AAKP Global, launched in 2019, AAKP is engaged internationally because we are committed to educating patients and leaders across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that a united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe care treatments. Globally, we are working with patients, medical professionals, researchers, and medical industry allies to cultivate a united consortium led by patients. AAKP believes this international consortium can advance innovation and change kidney care in countries where healthcare systems and/or infrastructure do not support patient consumer choice and/or access to care or treatments. For our panel session on a global drive for innovation in home dialysis, industry responds to growing demand for home therapies. I am now pleased to introduce Dr. Peter Rutherford. He's the Vice President and Global Medical Lead of Renal Care for Baxter International. As a global company focused on advancing research and innovation in home dialysis therapies, we are honored to have Dr. Rutherford with us to share Baxter's commitment to improving patient care and ensuring patients have access to treatment that aligns with their care choice and personal and life aspirations. Dr. Rutherford, I turn it over to you.
Hi everybody, I'm Professor Peter Rutherford. I'm the Head of Medical Affairs at Baxter Renal. I've been a practicing nephrologist for many years, firstly as an academic nephrologist in the UK, and then I moved to industry, and I've worked mostly with Baxter since 2007. My mission in Baxter is to support the evidence, to support the knowledge and the experience of patients as they choose home dialysis. And I'm really pleased to be with you here today, and thanks very much for the invitation to share some thoughts around innovation and increasing home dialysis, and critically, removing some of the disparities of care. You're going to see the challenge, and this is the global challenge. And for us in Baxter, we're thinking and working globally, but really aiming to improve access locally. The challenge really is global. Look at this graph of the number of patients that are on dialysis in the blue with the estimate going forward. But then look at the orange. This is those that are estimated to really need dialysis. And this is a huge disparity. We have a problem with access to care. Innovation is going to play a part, but there's going to be other aspects too, other things that we really need to work together on to improve access locally. Let's focus a little bit more on that healthcare innovation and think what makes it successful. And we can all think of innovation in our own lives and things that have worked and things that frankly have been less successful. In healthcare, we have to get it right, and we have to make sure that patient access to home dialysis really works. So what makes innovation successful? Well, firstly, it's got to meet an unmet need. It's no good having things that really are very good, very innovative, but where patients, people living with chronic kidney disease, it's not their problem. We really need to have innovation that meets unmet needs. So we need to know the unmet needs. It's therefore got to be focused on what makes, firstly, things better for patients. It's got to be patient-centric. That word's used a lot now, but it really needs to be true that the unmet need and the innovation has to be based on what matters to patients. And secondly as well, it needs to help and be centric around the healthcare professional, particularly as they discuss around dialysis options with patients that are approaching the need for that decision. And then the last thing about innovation, it only works if it's used. It seems a bit of a statement of the obvious on that. But again, we all know from our experience as people, innovation, great idea, but it didn't work. It wasn't adopted. It never got through. And again, that's work, that's activity. That's things that really need to be working across to make sure that that innovation is adopted successfully. And part of this is going to be about empowering access, patients to access to get home care. Because this is a challenge globally. Look, here's 4 or 5 countries or regions in the world. Every patient is unique. Every patient's journey is unique, but they're all going to come to the point of a dialysis decision. And look how that decision is then enacted in different countries. There's US around 12% on home dialysis. But look at other countries. Look at New Zealand or the Nordic countries where the use of home dialysis is much, much higher. But then also, sadly, compare and contrast other countries with Germany and Japan, where the uptake of home dialysis has always been a challenge. That adds to the problem we've already seen about access to any dialysis in large parts of the world. So thinking about what Baxter's doing, we pioneered home kidney dialysis over 50 years ago. I wasn't quite in practice then, but not that long after. And I remember the innovative use of home PD and then the spreading of innovation with new technologies to allow more people to have more choices. But also that's led to the way around connecting kidney patients more to their healthcare professionals and vice versa, to allow better understanding of what's happening day to day. It can be very lonely on dialysis, and connectivity can help there. So we launched ShareSource, the remote connectivity for our Claria and Amia cyclers, and we've seen benefits. I'd particularly want to call out the benefit here on the left-hand side about improving time on therapy, that in the first 2 years, using ShareSource, so it's having it and using it, extended therapy and allowed more patients to stay on for 3.5 months almost in that first 2 years. So we've got to get better at this connectivity. And in tomorrow, we've got to shift that reactive to proactive care, seeing a problem early, intervening to prevent the problem getting it worse, and making it easier for patients to start on dialysis and to start on home dialysis. That must be a very challenging time. So much uncertainty, so much anxiety, so much burden. So what can we do with innovation to make this better? And also, we read in the press, the availability of particularly PD nurses is a real challenge everywhere, globally. And it's not going to get easier. It's not going to get easier. So we've got to think around how to make, with remote care, make clinics more efficient as well as clinically effective. You'll see the innovation to advance other standards in kidney care. And this is our development of our next generation APD cycler, which we're working on now. Look, this isn't going to be ready for the next couple of years, but we're working on a new design which really translates in particular to patient benefit, making things simpler, making things quicker, making setup and takedown, make these things easier, and remote servicing. The patients may love the Baxter technical helpline and the engineer coming, but you know what? It would be much easier if problems could be seen and managed locally in the patient's home without any disturbance to their daily routine. And it's really designed around meeting patient needs. Really, this is a critical element around how dialysis starts. It starts with a decision that should be shared between the physician and the patient, where the physician brings the knowledge of the clinical disease, the pathway, the evidence. The patient is the expert in themselves and what they want and how they see the therapy interacting with their values and their goals. And the physician's job is to listen and really listen to those values and desires. So this is something that we think is also important for innovation. It's important to think patient information. So on the left-hand side of this slide is about My Kidney Care, a global resource translated into many languages to help patients see options clearly in their own language and help them understand what's available. And we're working on some innovative processes, both face-to-face, but remote learning, particularly for healthcare professionals, about how they can empower their patients to make shared decisions and to make those shared decisions in a timely way so that dialysis can be started calmly, correctly, optimally, and optimal to the patient's choice. home dialysis with a PD catheter as a pleasant start, or if they choose inpatient in-center hemodialysis, but with a fistula. It's all about shared decision making and innovative ways to get physicians to work with their patients more effectively. That's my presentation. I just want to thank you for the opportunity, but that's about end-stage kidney disease. It's a global problem. And thank you so much for your attention and your focus on helping patients all around the world innovatively to make life easier and better for them and their families. Thanks very much.
Thank you, Dr. Rutherford, for spending time with us and sharing Baxter's International's ongoing commitment to kidney patients.